Hello and welcome to today's webinar. My name is Madison and I will be your narrator today. This is the third webinar of the Medical Self-Care series. This is the second phase of the Medical Self-Care series entitled Recognizing and Reacting to Your Symptoms. Without further ado, I'll get started with today's webinar. I want to remind you that we're doing this webinar series mainly because we care about you and your health matters. Healthcare is a very important resource and we want to help you get the most out of your healthcare as it's ever-changing and confusing to the average person. And we're right there with you, and so we want to help you navigate through this system. There are three phases of medical self-care we've been going through, and like I said, this is the second phase, recognizing and reacting. The first phase, we focused on collecting information and contacting the right primary care physician. Today we'll focus on recognizing your symptoms and reacting appropriately. And the third phase to finish off the series is about preparing for your doctor's appointment and performing the way you want to perform. Alright, well let's get started with phase 2. I want to remind you that medical self-care is defined as what a person does to recognize, prevent, treat, and manage health problems on his or her own. There are a number of different definitions, but this is the one we'll be using for today's webinar, and we're going to talk about precisely these things in a moment. I also want to make it clear what medical self-care is not. It is not learning gross anatomy or acting like you're a doctor or a nurse, because that's not necessary, and that's not what we're about to tell you today and advise you to do. It's not a barrier to access care when it's needed. If you need to go to the doctor, then you simply need to go to the doctor. It's not about restricting care. And it's not about using unproven alternative treatments that you may have searched on a random internet site or heard about through a neighbor or friend. This is about actual proven methods of how to take care of yourself in a situation if you're able to use self-care methods. But most importantly, it's about knowing what to do, whether you should seek care or whether you are able to self-medicate, saving your time and money and your family's time and money as well, if you are able to self-medicate instead of going to the doctor and entering the healthcare system. Alright, so I just wanted to make it clear about what today's lecture is about. The primary objectives for today's webinar are recognizing your symptoms and the opportunity that you have a choice to make to self-medicate or enter the system, and reacting appropriately to those symptoms that you recognize in the situation that you're in. Let's get started with phase 2. I'm going to start with some information about the healthcare system and how it relates to what we're talking about today. The average American sees a doctor 4 times a year, and that might be surprising to you, but if you think about it, a lot of us go to the doctor for a number of different things. If it's not for just an annual physical exam, there's a number of other reasons that we might go to the doctor. This is probably more than a lot of us want to go to the doctor, and most likely it's more than a lot of us have to go to the doctor. We're going to talk about that more in the near future here in our webinar. The average American also fills 12 different prescriptions per year. This is a lot of prescriptions that we're on as Americans, and there are a lot of different ideas that go into this stat as far as prevention and taking care of ourselves and everything else. But if you look at these stats, we're definitely utilizing the healthcare system, and so it's just good to know our facts before we go in and talk about how we can maybe decrease utilizing the healthcare system so much and saving us time, energy, and money along the way. A lot of people do treat themselves for certain issues. As you can see on the screen, there are 80% of people who treat themselves for headaches. That's pretty common. A lot of us, can take an aspirin or whatever we might need to do to control a headache pain. 76% of us self-medicate for upset stomach or heartburn. 73% of us self-medicate for colds or cough, and 71% of us for fevers. So we are a little bit familiar, of course, with what we would consider minor illnesses, aches and pains and things like that. so we are a little bit we are familiar with the self-care system. What we're just going to talk about today is expanding upon that and thinking about are there other conditions that I might be able to seek advice and know what to do before running to the doctor besides just for the normal headache, heartburn, cold, cough, fever sort of ailment. Some stats on patient-provider communication. This is interesting. Patients usually have questions, but they ask them less than 10% of the time. So there's information that we have as patients, and if we asked our doctors, we would probably know more about medicating ourselves on our own in some instances. Of course, only for some instances this is appropriate. But according to the stat, a lot of the times we're just not asking those questions for whatever that reason may be. Whether it's we forget to write it down, to ask them, we're embarrassed to ask it, there's not enough time in the appointment, etc. The average patient has 4 questions that they either ask or that they have to ask, and it's interesting, they usually, according to the stat, only get 1.5 answers. So you can see that this is not a clear communication system that we have going on between patients and providers right now. 70% of correct diagnosis depends on what the patient tells the doctor. And we've talked about this in our past 2 webinars, that the majority of your diagnosis is going to depend on your medical record and the dialogue that you have through your doctor, through what you're telling him are your symptoms and your problems. In saying that, with knowing how our patient-provider communication is not working well, it's a scary thing to think that most of our diagnosis is just dependent on our record or what the words that we tell our doctor that day. Patients who write their questions down, both who write down their questions, they get better information, and they give better information, and they get better information. Alright, so it's a good idea to write these questions down, and if you do these things, you are more likely to be able to help yourself when you're in a situation where you don't know what to do, because you're able to ask the doctor that before or get sound advice when you're in your appointment. Less than 10% of medical decisions are made with participation from a fully informed patient. So again, we're not as informed as we could be, and if we worked on both ends, the patient and the provider, to have better communication, then that might help us to know what to do when we're on our own in the future when the appointment's over. And we might not have control over the provider and their communication strategies, but we can definitely impact as patients what we ask our doctor, how we engage with our doctor, and of course if we have all of our questions written down to help us to not forget as well. So this is just some facts to kind of set up our case for recognizing and reacting our symptoms. What patients want. It's interesting, they did, this is part of a study that they did, and they found when they surveyed that patients want appropriateness. Of course, they want the greatest benefit at the least amount of cost and risk, of course. Makes sense, right? And they also want an informed choice. So they want decision-making from the provider's point of view, and they also want to be provided with probabilities, outcomes, and then the patient, they want to be able to make an informed decision from all sides of the issue. Okay, so they want informed choice. And one of the ways that we can get this is from communicating with our doctor. And of course, the greatest benefit at the least amount of cost is going to be self-medicating in a situation that we are able to practice medical self-care. And that's also why it's so important to be informed so that you can make that correct informed choice. So the steps to recognizing your symptoms, this is pretty easy, just 3 easy steps we've broken it down into. The first is really important, stay calm. A lot of times we might rush to the doctor just because we are so worked up. We think this is a big emergency, which it may be, but it may not be. So the important thing to focus on here, no matter how important or much of an emergency a situation might be, staying calm is very vital in this process. Think it through. You want to think through your actions and know your options. So if a situation arises where you are experiencing symptoms, or one of your family members is, it's important to stay calm, think through it, and know the source that you're going to go to. Are you going to go to a self-care book? Do you have one nearby? Are you going to go to a trusted online source? Or are you going to call a nurse line? And we're going to talk about all of these in more detail coming up next. This is also sheds light on why it's so important to have a personal health record. A personal health record is going to help you know the history, of course, of either yourself or the person that you're taking care of. And it also is going to help the doctor if you do happen to enter the medical system. But if you're just at home and something happens, of course, you're most likely going to know your health record. But if it's one of your children, or if you're taking care, of somebody else, it's really important to know their health record, because that could, play a part in the decision-making process. A reminder that, again, this is not about knowing gross anatomy or trying to be a doctor. It's just about knowing what to do in a certain situation. And if you really need to go to the doctor and that's the only option, then that's what you need to do. And it's also important to avoid using unproven treatments or doing procedures or something that you're uncomfortable doing. If you're using a self-care book and it says, oh, you can self-treat, this splint or whatever it is, and you just don't feel comfortable doing it, and you just don't know if you're doing it right, and you are not able to seek any other care, maybe you do need to, go to a urgent care facility or whatever it may be. So we're not saying that you should, be doing procedures and treatments that you're not comfortable with, because you most likely are not a doctor or a nurse. But use discretion and make smart choices in recognizing your symptoms. So that was the first part of phase 2, recognizing your symptoms. We're going to move into reacting appropriately to symptoms and situations. When you're reacting to a situation like we're talking about here, where there's a possible medical emergency on the line, you need to ask yourself, first of all, is this a real medical emergency? When do I need to consult a physician? Is it now? Is it in a week? Can I treat this illness myself? And what self-care procedures should I use? So these are they kind of seem like simple questions, but it's important to prepare yourself for the questions that you're going to need to ask yourself in an emergency situation, because it might be more of an important emergency than you might have anticipated whatever happened to you or your family member, and you just need to be prepared to ask yourself, okay, how big an emergency is this? Can I self-medicate? Do I need to go to the hospital? When do I need to consult my physician? Can I treat this myself? And what procedures should I use? We're going to talk more in depth about different self-care publications, and I have mentioned this in the first webinar we did, but there are a number of self-care guides that you can use. We use Welkoa's Guide to Self-Care because it's a relatively inexpensive book format of self-care, and it's a really great publication. Would definitely recommend it for your family or work sites or wherever it may be. Health at Home is also a great publication. It's a little more detailed, a bigger book. Also always great, of course, to have at home. It's called Health at Home. And then the Mayo Clinic Guide to Self-Care is great as well, and that is also another detailed, larger publication. All very good. Online resources, you want to make sure that these are resources you can trust, of course, not just a random website that you looked up, that you Googled in a panic. WebMD can be a good website to turn to. TheMayoClinic.com, any sort of those reputable clinic websites, the Cleveland Clinic, things like that, they're of course more likely to have sound information in them than Googling whatever other symptoms that you're dealing with. A nurse line can be very, very important, and I say that because a lot of the times we want to be sure of the decisions we're making, especially if it's a more serious situation, or at least we think it might be a more serious situation, and so sometimes a book or a website are not enough to really convince us of what to do or not, which is where a nurse line can really come in handy. I've listed some examples of a nurse line that might be through your insurance carrier. A lot of times your medical insurance will have a hotline number that you can call in at any time. For Highmark members, it's Blues on Call, and there's also UPMC nurse line, just as a couple examples. And these are so great because it's 24/7 access to a professional, a nurse or a doctor, most likely a nurse, of course. And this is wonderful because you can call in, you can talk to somebody real time and get professional advice as to what you should do and if you should go to the hospital or not. So definitely recommend the nurse line. Alright, so the primary objectives for Phase 2 were to recognize symptoms and the opportunity to make a choice and react appropriately to symptoms and situations. I hope that you'll be joining us as well for the third phase of our medical self-care webinar series, Preparing and Performing. This wraps up Phase 2. Thank you so much for listening today, and if you have any questions, of course, you can always email us at livewell@babbins.com. We look forward to seeing you next time. Thank you.